It's important to know the proper procedure because you and your patient could be injured if you don't. This is one way to do a one-person, minimal assist repositioning up in bed. Before you begin, look at the patient's care plan or transfer logo to see if there are any special considerations you must take into account before assisting the patient. Make certain you have the proper equipment required. For this video, we will be using a slider tube. Only attempt this positioning if you have had training on how to do so properly. This positioning should only be done if the patient has sufficient strength to assist with the task. If any of these criteria are not met, do not attempt the positioning. Be certain the bed is flat, the brakes are locked, and the bed height is adjusted to the top of your hip bones. Place a pillow against the headboard to prevent injury to the patient. Begin by placing a tube slider or a slider sheet folded in half under the patient using a technique you learned during your training. Make sure the patient's shoulders are on the slider. The top of the slider is level with the patient's ear. The closed end of the slider should also be positioned toward the head of the patient. Ask the patient to bend his or her knees with feet flat on the mattress. Position yourself at the foot of the patient's bed, facing the patient, spine upright, shoulders back, elbows in, hips and knees bent, feet positioned in a wide walking stance, and abdominals slightly contracted. Have the patient count down and cue you when they are ready. Hold the patient's feet as he or she lifts their hips slightly off the bed, tucks in their chin, and uses their feet to move themselves up in bed. Once the patient is in position, remove the slider using the technique you learned during training. Make sure the patient is comfortable and thank the patient for their effort.